Hey everybody, my name is Lynndy, and today we're going to be covering our third part of our Thrive in 5, which is hydration. So I grabbed a research article from the Journal of Biological Chemistries, and they basically said that 64% of our skin is made of water, 73% of our brain and our hearts are made of water, 79% of our kidneys and our muscles are made of water, and surprisingly enough, 31% of our bones are made of water. When you add all that stuff together, you roughly get about 70%, and so 70% of your body's made of water. If you get dehydrated, you can potentially back up to 70% of your processes. One of the biggest processes we know that water is utilized as a process called healing. You can't heal so well if you don't have enough water, so boost the water up to actually help with the healing processes. Now, the other processes in your body, blood uses is 90% made of water, and we use blood to actually transport around our blood gases, oxygen, carbon dioxide, nitrogen, as well as waste materials and nutrition throughout it. So we actually need the water to actually work for our transport systems. We're looking at things like, say, our blood pressure. You need water for your blood pressure, so we get the blood to go up to our brain so we can actually stay awake. If the blood drops away from our brain, we're going to pass out, and those people usually suffer from adrenal issues or water deprivation. If it's a water deprivation issue, because that's what we're talking about right now, I actually get my patients to boost up more water, and just by increasing their water can actually maybe help to balance out the blood pressure issue. That's something to discuss with your medical provider, okay? Otherwise, your airways need it. We talked about this, 90% of my patients with asthma and allergies show signs of dehydration. So again, if you're down on your water, you can actually cause mucus formation to be in there, and you'll get crusties in your eyes, nose in the mornings. You'll notice your eyes get a lot more water. You'll notice that you'll get some drippiness down your nose or post-nasal drip coming down. Mouth will probably dry out. You'll get cracked lips. Notice your skin feels a little bit more dry. You'll notice that if you take your fingers and rake them up your shin a little bit lightly, that it might fray up your skin a little bit, cause some little ashiness right there. So again, if you get that sort of aspects going on right there, those are all symptoms of dehydration. So again, boost that water up to get your body more hydrated. Also, when your skin is dehydrated, it looks more wrinkly and you look older. If you get more plumpness to it there, it actually makes your skin look younger. So who doesn't want to look younger, right? So try to get the water in and look a little bit healthier and younger in general. We talked about processings in general. Mucus is made of water. Now, at the same point, which your body uses that stuff for protection, so you don't dry yourself out, but we use saliva for our digestive aspects. Saliva is used to actually help with motility. If you got a lot more water in your mouth, it actually helps to keep it more clean for your neighbors, so they'll like a nice, clean mouth around you. At the same point, in digestive aspects, water is utilized in breaking down all the major macronutrients. So proteins, carbohydrates, fats, and nucleic acids. None of those things would break down without water usage, so we wouldn't be able to absorb the nutrition that we're actually eating from the foods that we're having without the processing of water. So you need water quite a bit with regards to the digestive processes. Getting rid of the waste materials. So your kidneys do that. They actually take the waste materials from your body and they shrink it down, they concentrate, and then try and get it out through urination. Now they will suck the fluid back in through the kidneys, and then we use that other process through the defecation cycle to try and get feces out throughout the body. Now when you become dehydrated, what you'll notice is that you get a lot darker in your urine color. At the same time, you get more dehydrated. You'll notice that feces, it doesn't come out so easy. You might have to sit and strain on the toilet for a little while, or if you notice you get little pellets coming out, rounded pellets, it should be coming out like a soft serve ice cream, people. If it comes out like pellets, that's signs of dehydration. That's friction there, and these things are rolling where they should be sliding through that area, okay? So again, if you don't have enough water to get your kidneys processing and getting fluid reabsorbed in there, and you become dehydrated, technically speaking, the waste materials in your bloodstream could be coming out of the nearest avenue, which could be your pores at times. So you might even notice you get skin eruptions, you get dermatological reactions because you don't have enough water in your body. So try to get the water and help with that skin healthiness that we just talked about. Water helps out with the cushioning of the brain and the spinal cord, as well as any other sensitive tissues. I got my brain inside the spinal cord, I'm jumping around, that's going to bang that thing around. That's not going to help anybody out. So you need to actually have what's called cerebral spinal fluid in there, which is nutritionally rich to actually help support the brain and spinal cord, so you can jump around and actually not cause so much for injuries. And now your lubrication of your joints, we use synovial fluid in there, which is also made of water. That gives the connection and the cushioning effect when you're jumping on the body. If I don't have enough water in there, I could actually cause a decrease to that cushioning effect, and that can cause joint pains. Yes, you can get more pains by not having enough water. We talked about athletic performances in general. There's at least one research article out there that talks about if you get dehydrated and you have to do at least 30 minutes of exercising, then potentially you're gonna decrease your work performance by being dehydrated that way. There's a research article put out by Harvard where this medical doctor, she had talked about there's an increase of bacterial virus formations in dry rooms. So I talk about with your mouth, nose. When we're dry, breathing through these things a lot, we get a lot more dry in general, because if you're not lubricating from the inside, we actually have bacteria and viruses in there all the time, and your body's supposed to take care of these things through the immune system. But if that water's not there to help boost up that immune system, then we'll actually get an increase of sinusitis, if not sinus infections. So get that water in there to help with the processing of these sort of things. So in general, when you look at amounts, you should be having 2 to 4 liters of water per day, every day for the average individual. But if you have things like, say, coffee, pop, tea, alcohol, those aren't so good for your body, so your body's gonna waste your own precious water to get those things out of you. So if I had, say, 20 ounces of water, I should have a 2-for-1 rule and have 40 ounces of I have 20 ounces of coffee, pop, tea, alcohol. I should have 40 ounces of water to help counteract that coffee, pop, tea, alcohol that I had. And that's above and beyond the 2 to 4 liters that we talked about per day, okay? So you need to, your body does lots of processes that water's utilized in. Get the hydration in there to help with these processes, get your body functioning better on the inside. It's gonna boost the immune system up. It's gonna get us functioning through this time of need and through the cold allergy symptoms that we're dealing with right now. Otherwise, you like the information you heard, give us a little thumbs up. Got some family and friends after actually have to deal with some hydration stuff going on, please send this video out to them, help them boost up that immune system also. Otherwise, like our information in, come back next time and actually cover the other ones we're going to cover in our Thrive at 5, which is going to be exercising and mindset. Otherwise, you have yourself a good night, and we'll talk to you soon.